Which DA form is required to order Schedule II controlled substances? A. DA Form 41. B. DA Form 222. C. DA Form 106. D. DA Form 224. Answer, B. DA Form 222 is used specifically for the ordering, transferring, or returning of Schedule II controlled substances. What is the beyond use date for a multi-dose vial of insulin once opened? A. 14 days. B. 28 days. C. 7 days. D. 60 days. Answer, B. Insulin vials should be discarded 28 days after opening per USP guidelines to prevent degradation and contamination. Which of the following medications must be dispensed with a med guide? A. Lisinopril. B. Albuterol. C. Isotretinoin. D. Amoxicillin. Answer, C. Isotretinoin requires a medication guide due to serious birth defect risks and other side effects. What is the purpose of the REMS program? A. To replace the Orange Book. B. To ensure medication safety. C. To schedule controlled substances. D. To speed up drug approvals. Answer, B. The Risk Evaluation and Mitigation Strategy, REMS, is required by the FDA to ensure benefits of certain drugs outweigh risks. Which of the following pairs indicates a drug-drug interaction? A. Warfarin and acetaminophen. B. Lisinopril and amoxicillin. C. Warfarin and aspirin. D. Omeprazole and diphenhydramine. Answer, C. Both have anticoagulant properties and may increase bleeding risk when taken together. Which part of the NDC number identifies the product? A. First set. B. Second set. C. Third set. D. All sets. Answer, B. The second set of the National Drug Code, NDC, identifies the specific strength, dosage form, and formulation. What is the maximum allowable refills for a Schedule III medication? A. None. B. 1. C. 5. D. Unlimited. Answer, C. Schedule IIIV drugs can be refilled up to 5 times within 6 months of the original prescription date. Which law created the distinction between prescription and over-the-counter drugs? A. Kefauver-Harris Amendment. B. Food, Drug, and Cosmetic Act. C. Durham-Humphrey Amendment. D. Controlled Substances Act. Answer, C. The 1951 Durham-Humphrey Amendment established the legal distinction between prescription and OTC drugs. What is the meaning of the abbreviation SIG? A. Write on label. B. Take with food. C. Dispense as written. D. Before meals. Answer, A. SIG is Latin for signa, meaning the directions to be written on the label. What class of recall is used for products that are likely to cause serious harm or death? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer, A. Class 1 recalls are the most severe and involve products that could cause serious adverse health consequences or death. Which agency regulates the labeling and safety of prescription drugs? A. DEA. B. OSHA. C. FDA. D. EPA. Answer, C. The Food and Drug Administration, FDA, oversees the safety and efficacy of medications and their labeling. What is the generic name for Norvasc? A. Amlodipine. B. Atenolol. C. Lisinopril. D. Metoprolol. Answer A. Norvasc is a brand name for amlodipine, a calcium channel blocker used to treat high blood pressure. A technician receives a prescription for amoxicillin 500 mg TID times 10 days. How many capsules are needed? A. 20. B. 30. C. 40. D. 60. Answer B. TID means 3 times a day, over 10 days, 3 times 10 is equal to 30 capsules. What is the primary storage requirement for insulin? A. Room temperature only. B. Below freezing. C. Refrigeration between 2 degrees Celsius to 8 degrees Celsius. D. Warm and dry area. Answer C. Insulin must be refrigerated before opening to maintain efficacy and safety. What does the abbreviation DAW mean? A. Do after work. B. Dispense at will. C. Dispense as written. D. Double authorized withdrawal. Answer C. DAW instructs the pharmacist to dispense the exact brand prescribed without substitution. What is the primary role of a pharmacy technician in compounding? A. Counsel the patient. B. Create and label preparations. C. Write prescriptions. D. Approve final product. Answer B. Technicians assist in compounding under pharmacist supervision and ensure accurate labeling. Which regulation requires pharmacies to keep patient information confidential? A. REMS. B. HIPAA. C. DEA. D. OBRA 90. Answer B. The Health Insurance Portability and Accountability Act protects patient health information privacy. What should be done if a technician discovers a medication error? A. Ignore it if minor. B. Notify the patient only. C. Alert the pharmacist immediately. D. Fix it quietly. Answer C. Technicians must report all suspected errors to the pharmacist to ensure patient safety. How many milliliters are in 2 teaspoons? A. 5 milliliters. B. 10 milliliters. C. 15 milliliters. D. 20 milliliters. Answer B. 1 teaspoon equals 5 milliliters, so 2 teaspoons equals 10 milliliters. Which drug requires iPledge program enrollment? A. Metformin. B. Amoxicillin. C. Isotretinoin. D. Levothyroxine. Answer C. Due to severe teratogenic effects, isotretinoin requires patients and prescribers to register with iPledge. How often must controlled substance inventory be completed per DA? A. Every 3 months. B. Annually. C. Every 2 years. D. Every 5 years. Answer C. The DA mandates a biennial inventory of all controlled substances. Which of the following medications must be dispensed in its original container due to light sensitivity? A. Nitroglycerin sublingual tablets. B. Acetaminophen. C. Ibuprofen. D. Loratadine. Answer A. Nitroglycerin is sensitive to light and moisture. It must remain in its original amber glass container. Which act created the FDA? A. Food, Drug, and Cosmetic Act. B. Pure Food and Drug Act. C. Durham-Humphrey Amendment. D. Controlled Substances Act. Answer B. Enacted in 1906, this act laid the foundation for the creation of the FDA. What type of error involves giving the wrong drug to a patient? A. Omission error. B. Commission error. C. Dispensing error. D. Monitoring error. Answer: C. Dispensing errors occur when the wrong medication or dose is given to the patient. A drug labeled as hazardous must be handled with A. Bare hands. B. Sterile gloves only. C. Personal protective equipment, PPE. D. Double packaging only. Answer: C. Hazardous drugs require the use of PPE to prevent exposure and contamination.